Welcome to the BioBalance Healthcast, episode 689. Were you told your estrogen levels are too high?
BioBalance Healthcast features conversations about anti-aging medicine. Your host is Dr. Kathy Maupin, Medical Director of BioBalance Health and a leading expert in treating symptoms of aging. Dr. Maupin is the author of The Secret Female Hormone, the seminal work about testosterone replacement therapy for women, and Got Testosterone, the award-winning book for men that helps men choose the most effective and safe form of testosterone replacement. These books are available on Amazon or from Dr. Maupin's office at BioBalance Health in St. Louis and in Kansas City. Dr. Maupin's office is currently accepting new patients.
Welcome to the BioBalance Healthcast. I'm Dr. Kathy Maupin, and today we are going to talk about estrogen. But we're going to talk about a specific situation that many of my patients find themselves in, and I'm sure if you're taking estrogen from another bioidentical estrogen doctor who uses bioidentical estrogens, pellets or any other type, and another doctor for some reason draws your estrogen level, and says, oh, your estrogen level is too high. Now, first of all, what I have to say about that is that their specialty? I mean, I don't weigh in on what they see on a colonoscopy or what they see when they're doing a heart cath. They don't really understand what estradiol levels mean in the blood and where they come from. So, I was reviewing a chart that made me think I should talk about this because I reviewed several charts in a row where my patients were very upset because their family doctor or another doctor looked at their lab that I had drawn and I was managing and said, you have to get off estrogen. Your estrogen's too high. And then that normal estrogen for someone who is menopausal can be 0, and that doesn't mean it's healthy. It just means that's what they have, and that means they have a lot of other symptoms and problems. A normal estrogen for a young, healthy person is 60 to 250, sometimes 300 during the cycle. That's the same normal as it should be for people who are menopausal and taking estrogen. You should have an estradiol level between 60 and 250, ideally. There are times when that goes up and down, but having said that, I also want to tell you there's a big difference in patients. Everybody's an individual. If somebody loves their estrogen at a level less than 60, like 40, and they don't have any symptoms of low estrogen, no dry vagina, no hot flashes, they're not losing the hair on the frontal part of their scalp. If they feel great on a very low level of estrogen, that's genetically programmed. I have people who feel great only when their estrogen is 250. Now that's a little unusual. Not as many patients are in that group. But they feel great when it's 250, and when it's 60, they feel terrible, and they get hot flashes, night sweats, dry vagina. They're miserable. So it's not just about the number. However, the doctors that are criticizing, either the patient or the doctor who prescribed it, doesn't know any of this, and they've never studied it. So they've never seen thousands of patients for half my life who had estrogen problems. So when I saw this patient who was very upset, and my nurse practitioner and I were talking about it, she was upset, so upset that she asked not to get estrogen. The next time, every 4 months, we give estrogen and testosterone to menopausal women, and she asked not to get it. Well, we didn't give it to her. She wanted not to have it, but she was getting symptoms of low estrogen, yet when her blood was drawn, it was only a tiny bit lower. And then we waited again 8 months later after the last dose, and it was still around 60. Well, that's interesting, but it's not something that came from the pellet. The pellets are so tiny. They're a few millimeters in diameter, and they only last about 4 months, maybe 5 if I'm lucky. So if somebody has an estrogen level after they've had their pellets, and the pellet has to be gone, then that's estrogen that is being made somewhere else in the body. Now we have to rule out other places. Well, one place is the ovaries that aren't working anymore. After menopause, you're not making estrogen. You're not making estradiol, at least. You can make, if you're given testosterone and no estrogen, testosterone can be converted into estrogen, and that's really one of the ways that people get estrogen from their testosterone and have estrogen after menopause, but they don't feel good with that estrogen. It's usually estrone, and it doesn't make them feel good, and it makes them gain weight. So that's the second possibility for women. But the third possibility is that estrogen is made in your fat. So I may be giving estrogen to a patient, and it helps her symptoms, but the estrogen that is coming from her fat doesn't make her feel better, but it increases the estradiol levels on her blood tests and her estrone levels. So if someone has a whole lot of adipose tissue, then it's very possible that their estrogen level is coming from fat. Now, when that same person loses weight, their estrogen level drops because they don't have as much fat to make estrogen. But that is the biggest reason that I found that people have elevated estrogen levels when they haven't been on estrogen for a year. I mean, by then it should totally be gone. So that's the truth about estrogen and menopausal women. So it isn't a reason to stop taking estrogen just because your level is in the non-menopausal range. That actually is good. That's what we're shooting for. But within that range, there are certain amounts of estrogen that feel better to some women than others. Some people are on 6 milligrams every 4 months. They feel great. If I had 6 milligrams every 4 months, I'd have hot flashes, night sweats, I wouldn't sleep, I would be miserable, dry vagina, painful intercourse, all those things would have happened to me quite soon after getting the pellets because 6 milligrams in me is not going to last very long. So not only do you have fat to make other estrogens than what I'm giving you, but you also have a liver that's breaking estrogens down, and everybody's liver is different. If you're on lots of different drugs that go through the same enzyme system as estrogen, it's like a traffic jam. It kind of blocks all of those drugs from being broken down, and so estrogen is one of them. So your estrogen might stay higher longer. So you may not need as much in a pellet. If you still feel good, we aren't going to advise you to take more. So we always have to look at symptoms, just like everything else, symptoms and blood levels, not just one or the other. That's what we do with women in menopause. Now, women in menopause who have breast cancer, we had another patient who had developed breast cancer. She had been taking estrogen and testosterone. She chose to stay on testosterone. And her oncologist, I'm not sure why, because most oncologists let their patients take testosterone because it actually helps them fight cancer. But this oncologist said no and put her on something called tamoxifen. Well, tamoxifen blocks estrogen in the breast, but tamoxifen is actually estradiol. It's really an estrogen for the rest of your body, but not an estrogen for the breast. So it goes into the receptors and blocks them so that nothing else can attach to the receptor sites in the breast. So even though that is an adequate treatment for breast cancer, following estrogen levels and hoping they'll go down while you're taking tamoxifen is futile. It will always be high, and it is not a pellet that was in there a year ago. That is, so honestly, the doctors that use tamoxifen should know that it's an estrogen and that it's going to keep the estrogen level up. People with estrogen positive receptors are the ones that get tamoxifen, and they're the ones that oftentimes are very upset because their estrogen just won't come down. But unfortunately for them, their oncologist can't give them that answer. They just blame us. And for us, it's like, yeah, well, you're on tamoxifen. When you're off tamoxifen, your estrogen will drop. There are other treatments for breast cancer, and most of them have to do with estrogen as well. One of them is an Estradiol or a Arimidex, and it stops the conversion of testosterone into estrogen. So that is a good way to drop estrogen levels, and unless you're making a lot in the fat, you'll actually see the levels go down. So when we're looking at people trying to get rid of the estrogen in their body, so one cell that might be breast cancer doesn't grow into many, we do follow estrogen levels. But if we have a patient who has a lot of adipose tissue, it may not always go down, but it's not the drug we gave them. In any case, that's what doctors worry about, estrogen levels for some reason. And honestly, I think that's a throwback to when we used to believe that estrogen caused breast cancer. It doesn't cause breast cancer. We now know that it actually, well, if you get breast cancer after you've been on a non-oral form of estrogen, hopefully estradiol, then you will probably have an easier treatable breast cancer. If you have not been on it, and you have not taken any estrogen, it's much harder to treat those breast cancers. People who have been on estrogen and testosterone have a much better resolution to their cancer. It's easier to treat, and they have a longer lifetime. So it's not going to cause breast cancer, but if you have a breast cancer with estrogen receptors, it may make it grow. So we don't give additional estrogen to patients who have breast cancer. So that's trying to sort out some of these issues. So sometimes other medications can cause other medications. It's not just that. It's medications and supplements can cause estrogen to show up in the blood. You don't usually get symptom relief with these, but you can see a high estrogen level, and the medication, of course, is, there's several other medications, but tamoxifen is the biggest one, and the supplements are all the soy products. Soy products, they call them phytoestrogens. People come to me on a bunch of phytoestrogens trying to get rid of their hot flashes. It doesn't work very well for hot flashes, but their estrogen level's high. And their estrogen level's even higher, and that's the one that gives you kind of fogginess, belly fat. It comes from the liver. It comes from the adrenal gland. It is converted into estrogen in the fat, kind of stays there. It's stored there. So that is something that comes from not a drug, not a pellet, not a hormone replacement. I don't think most people think about soy nuts. At the height of my weight, when I was a kid, I ate handfuls of soy nuts every day, and that made me have belly fat. It was awful. I almost ate nothing else, and I thought they were good for me. Soy is in almost everything. You have to try to avoid it if you want to get rid of the estrogen in your diet. Tofu, vegan fake meat that they make is usually out of soy. Edamame, which I think tastes really good, but is not necessarily good for you. And I'm going to give this except if you're Asian or you have Asian heritage, then soy seems to be okay for you guys. I don't know why, but in the studies it shows that it doesn't turn into estrogen, so it's not as dangerous in terms of having an estrogen that does not make you feel good, but you're eating it, and then you're storing it in your fat, and in some people that can cause infertility, and some people that can cause breast tenderness, and some people, basically it's going to make your blood work look high, but it's not the kind of estrogen that makes you feel better or gets rid of your hot flashes. So I don't advise anyone to do that, trying to get rid of their hot flashes. There are a couple of genetic defects that we carry. Some of us carry an aromatase defect, and that's a defect where the testosterone is made into estrogen with a very fast enzyme. The enzyme takes a lot of the testosterone away, and the estrogen goes up. So we watch the testosterone go like this. Testosterone's down, estrogen's up. And what that does is estrogen then binds the testosterone, so we can't use it. And it also competes for the receptor sites. So we can't feel our testosterone. So we use something called Arimidex and Estradiol, but we use it with estrogen and testosterone to block that fast conversion. So we find out not by doing a genetic test, but by how they respond to their estrogen and testosterone on the first visit. We can usually diagnose that. We can also treat it with something that's not oral Arimidex. We treat the same problem with testosterone and anastrozole in a pellet. So they're combined in the pellet. They dissolve over the course of 4 to 5 months, and that drops the estrone that is being made out of the testosterone. So the last thing is DIM. DIM can treat the fast conversion of testosterone into estrogen. So we look at all of these things. We put people on supplements. We look at their diet. We take them off soy products. We look at how they're metabolizing their testosterone into estrogen. We try to keep the estrogen at a normal level, because if it gets too high, patients have symptoms. They have tender breasts, or they have too much vaginal wetness. They just don't like it. I see that. So that would be coming from too high in estrogen. So nothing is good, not even water, if you drink too much or don't drink enough. Same thing with estrogen. You have to be within a certain range for you. And whatever is good for you now is probably going to be good for you in the future. So these are the things that we have to look at to make sure somebody's estrogen is normal and for that person. And we try to keep it in a range, but we have to listen to our patients and hear what their symptoms are and look through all of the things that they do to make sure that they are not creating a problem by making too much estrogen, storing it in their fat, and then having it show up after we've done pellets and they are off of the estrogen portion. So if you've had this problem with any of your providers or doctors, then this may be helpful for them and may be helpful for you to understand what they're trying to do. But you can see how complicated it is. And a doctor just looking at your blood level can't make a comment like, that's too much, that's not enough. If they don't know everything, they can't make that judgment. And if they're not trained in it, they can't make that judgment. So I hope this has solved some of your worry, keeps you out of calling a doctor over this, because it's just one of the phone calls we take, but you shouldn't have to be anxious. Anxiety is not good for you, so we don't want you to be anxious about this. There's lots of things to be worried about, not this. So enjoy your hormone replacement therapy, and don't worry about any of these problems with having too much estrogen.
Email your questions or comments to podcast@biobalancehealth.com. You can find the BioBalance Healthcast on iTunes and on YouTube. For more information about bioidentical hormone pellet therapy and other reverse aging solutions, visit biobalancehealth.com or call 314-993-0963. You can find Dr. Maupin on Twitter @Dr. Kathy Maupin and on Facebook at facebook.com/biobalancehealth.